The Philippine Health Insurance Corporation, otherwise known as PhilHealth, has amassed some 173 billion from premiums and contributions from its members through in government supplemental funding of 100 billion, and that's over $250 billion in its war chest. That is how Solons noted in its inquiry into complaints of PhilHealth's rather inadequate co-pays for more costly treatment, hospitalization, and medication. A law is in order to mandate PhilHealth to pay more of its members, as our Clazel Pardilla reports.
In a recent hearing by the House Committee on Health, it was revealed that the Philippine Health Insurance Corporation, or PhilHealth, has accumulated a staggering 173 billion pesos from the premiums or contributions of its members. This amount is further supplemented by up to 100 billion pesos in government funding. Despite this significant financial resources, concerns have been raised about the inadequacy of health benefits provided to Filipinos.
Masyadong malaki ang sinisingil natin sa ating mga manggagawa. But ironically, the benefit spending is too low. The benefits that we receive, that we as members receive, are too low. Out-of-pocket spending on the average is still about just 50%. So that's among the lowest in the ASEAN. And in fact, pag pupunta tayo sa ospital, kailangan pa natin humingi ng tulong mula sa malasakit. And recently,
lawmakers have put forward a proposal to amend the Universal Healthcare Law. The proposed changes aim to reduce the contributions required from members of the PhilHealth insurance program, which seeks to alleviate the financial burden on Filipinos while ensuring the healthcare system remains robust and accessible.
Bakit hindi na lang natin bawasan yung sinisingil ng PhilHealth sa manggagawa? So sa ngayon po, ang sinisingil natin is 4.5%. Why don't we begin with a lower rate, 4%? Which means, pag i-compute po natin using NCR minimum wages, makakatipid ang ating manggagawa ng about 80 pesos per month.
Some lawmakers push for voluntary PhilHealth contributions for overseas Filipino workers. This proposal aims to ease the financial burden on OFWs who are already contributing significantly to the economy through remittances. However, the Health Department has expressed concern over this initiative.
Paano naman po yung mga dependents ng mga OFWs?
Di ba dapat nga, Mr. Chair, pag Universal Health Program, lahat, ang concept nito, lahat ng Pilipino ay dapat i-provide ng healthcare natin, whether it is paying or not.
Ang sinasabi lamang po natin, ang OFWs po natin, if I may reiterate, trillion of pesos, 37.2 billion US dollars po ang binibigay sa coffers natin na ang GDP ay 10%. That is much higher than lahat po ng other agencies na pinapasok po na pera sa ating kaban ng bayan.
Meanwhile, House Ways and Means Chair Joey Sarta Salceda is pushing for a separate senior citizens insurance program under PhilHealth to cover the catastrophic huge health expenditures. Salceda pointed out that the program is necessary because seniors tend to pay a larger share of the hospital bill out of pocket. Clazel Pardilla for the New and Better Philippines.